Slides 5. So tools, what are the tools that requires in health informatics? So from the term itself, informatics, most of it or not, all of you should understand that health informatics or information technology requires computers, but also in the health informatics is not only computers or the software or programs, but it also requires certain clinical guidelines, medical terminologies, information and communication system. So communication system is very important in health informatics. So be it like a particular software that actually run on a particular platform, without the communication system, it won't able to link from one end to another, from a clinician particular point of uh, arranging to the particular drug dispensing to the particular laboratories. So it is important to have a communication system. It is not just a software, not just developing a software, not just developing an apps, but it has to be communicated. These all particular platforms need to be communicated in a way. So in health informatics, communication systems is very important. But then again, it is not that you need to understand how the communication system works. That is under the another branch of engineering part. It's not your particular or the health informatics purview, you see. So it's just that needs some integration. Let's look at how this health informatics actually used worldwide. So slide 6, okay, indicate that CDC health informatics. So let's look at CDC, Center for Disease of Control. So is a CDC's health informatics here is a CDC National Center for Public Health Informatics, what we call that NCPHI, provides leadership in the application of information and computer science and technology to public health practice, research, and learning. So like it or not, when you talk about health, it's all very associated with always public health. And because of this, there really need integration of certain platform. So the electronic health record supports of public health function, the use of healthcare population and other public health data in supporting public health system and analysis, the basic capability that support public health practice such as statistical and health surveillance, and also public health decision support. So these are the area where the Center of Disease Control requires a certain platform. This particular platform or integrated system, what we call it, health informatics. So now we move on to another area, what we've always heard about is e-health, electronic health, we call it. So e-health is a broad term for healthcare practice, which is supported by electronic infrastructures, the processes, and also the communication. So very often that you will see that always the electronic component always the E. That means everything starts with the e-health, e-telemedicine, or whatever you name it, is always associated with telecommunication or the communication part. It's not, as I said, not just like a particular software, not like your PowerPoint, not like your words, not like your Excel. It doesn't require all these particular words, all this Microsoft, it doesn't require communication. That means you can actually uh, perform a task offline and you don't need to integrate. So it's like your own PC processing. But when you talk about health informatics, it is not just a silo or in silo kind of operating, but it's an integrated system. So the term can encompasses for the e-health is a range of services that are at the edge of medicine, healthcare, and information technology. So they integrated all this particular component. So sometimes you will also in this new era or what we call that in the mobile technology, you will also hear about M-Health. So M stand for mobile. So e-health, M-Health is about is part of the e-health. Okay, so it's a subset of e-health. So M-Health talk about mobile. Nowadays you can see many mobile apps available. Of course, if you just put in so if you register some of this app, it also allows you to do a booking, okay, a standard kind of clinic appointment bookings through the particular apps. You can see, for example, the COVID status look like the e-Sejahtera, My Sejahtera is something like a mobile health or public surveillance kind of integration systems. So mobile technology such as mobile phone to collect and access health information. So this is very important because it allows individual to access certain important data at the point where they are actually located. So they did not need to go to the clinic, they did not need to go to the library centers or to gather information. So with all this integrated system, everything is in their hand. So now informatics, as you know, it is not information technology. So information technology is not informatics. Okay, so information technology is hardware and software. So IT itself is to nouns as informatics is to verbs. As the verbs, informatics to help IT work appropriately. So do not confuse the terms. Although that they are associated, but they are not the same. Okay, use it wisely. So what are the key elements in informatics? So these are the few particular, I can say, important, not just limit to this, but these are the key elements that encompasses acquisition, storage, communication, manipulation, and display. So if you have all those four, acquisition, storage, communication, and manipulation, without the display, the whole informatics doesn't work because the individual cannot see, cannot appreciate the integration system because like it or not, system still remains system, but display and monitors and all these things are still another component for us to actually appreciate what are the outcome of this particular informatics. So now if you look at slide 11, health information system context. So it started with the community where you get all this data collection. And next, we move on to the facilities. You have also data collection and indicators. So now we move on to the district area. Then there is a data aggregation analysis. Then move to the national level. They have data aggregation analysis. And somehow in the international setting, again, there is also data aggregation and analysis. So every steps of this particular or level that involved in the health information is always the aggregation of certain data and a certain analysis need to perform. So let's move on to slide 12. So now, what are the principles in the health informatics? It uses the drive data and interoperability standards, and is incremental development and also strengthening of system. So it also enterprise of architecture approach and collaborative communities. So as I always say that keep on mentioning that health informatics is not one particular field alone. It's an integrated few particular disciplines. Make it in the electronic infrastructures and integrate that particular data. Slide 13. So this particular slide shows you flowchart showing that how this particular decision determine a certain data. So first, when you want to see, for example, should I change a particular treatment? So now from this particular question, so what type of data that you need to require to put in or to submit it to the database? So what we call that is a data collection. So after they collect all the data associated, what you need to change for the treatment, it's stored in a particular segment. So with this particular segment, then there is a knowledge resources. Knowledge resources here from the publication, from the depository, from other databases, then feed to this particular data storage. So of course, with all this information integrated system, machine learnings and etc. So then they will go through all this analysis. So very often you heard about big data. So this is what we call like big data integration and also analysis. So after they have analyzed what they need to do, the system, they need to present in a way that electronically in a particular display, okay, or a particular meaningful presentation, okay. So if that is the case, then the information completes, okay. So then you can see list of things that you require to change a particular treatment, okay. So now, what are the incremental strengthening of the system? So you must always have a a system in place in order to capture the data. This is a slide 14. So the goal should not be to implement a single system, but to encourage the development of interoperable systems. If it works, it will enhance it. Continuous and the entire system. We call enterprise architectures approach. So now there are many kind of approaches in a way to strengthening a particular system. So one of the most approaches will be enterprise architecture approach. So is to actually add in and enhance that existing system, not to overhaul the whole system by doing a small improvement here and there. Okay, so there are the approaches. So this particular slide shows you the enterprise architectures. Okay, so these are the particular preliminary frameworks. So if you look at the far top on the right, you see there's a one small preliminary frameworks and principles. So those are the things that fit into the requirement management, which is the center in the circles. The requirement management, this is slides 15. So requirement management. So under this requirement management, there are 8, okay, 8 components, which is architecture vision, business architectures, information system architectures, technology architectures, opportunities and solution, migration and planning, implementation and governance, and architecture change management. So these are the things that fit in to the requirements management, and subsequently the information from requirement management also fit into all these 8 elements. And not for your information, all these 8 elements also feeding to each other. Okay, so like that these are the complexity of the system in terms of making a decision of a certain or improvement of a particular system. So now, very often you will see that now when it comes to all this health informatics, you will realize that many versions in the slide 16, very often that you will see that there's upgrades. There's a new version of a certain approach, a new integration. So do you think that it is necessary to buy or to modify? So now, sometimes when you buy or you purchase a particular software just for the need of a small improvement, it might not necessarily fit to what you need, you see. But if you want to build a software from scratch, it's a very long, extensive processes, and some of the time it's not guaranteed to work. So the best, always the best, to modify, start with an open source software that you can modify. Of course, this tie with the programming and also certain modification skills, which I don't think any of you acquire this. This is more like in the programmers. So apart from that, there's modification of software to meet a certain exact requirements. And from that particular, everyone benefits from the particular changes of the particular software. Slide 17. So it shows you that collaborative communities of practice. So what are the collaboration life cycles? From the awareness, motivation, self-synchronization, participation, mediation, reciprocity, reflections, and engagement. So all these particular 8 elements are integrated or supporting to each other in the collaboration life cycles. So these are all informations related to health informatics. Now let's move on to some other terminologies that related with health informatics. So very often that you will hear about biomedical informatics and also bioinformatics and also health informatics. So now let's look at the terms here. Biomedical informatics is not bioinformatics. Okay, there is all difference. So now under this particular umbrella, you have all this small little area, what we call applied research and practice. So in the slides 18, so you will see that there are some components what we call bioinformatics, imaging informatics, clinical informatics, public health informatics. Or you see that the associated area all end with the informatics. So these are the subset of the component that are associated with all these either biomedical informatics or health informatics. So let's look at slides 19. So these particular area are highly associated with health informatics, which is the clinical informatics and public health informatics. So of course, you look at the area expanding in the slides 19, slides 19, it shows you that the area of expansions of the science is from the molecular and cellular processes all the way to population and society. So all you know that health informatics is more towards the end or the approaches on the population and society, whereas the biomedical informatics is more on the area where cellular, tissue, or molecular sciences are concerned. Okay, so those are the area that covers from biomedical informatics and also health informatics technology. So now BMI stands for biomedical informatics and HIT is stand for health informatics technology. So if you look at the on your right, you will see that these are the area that are associated with health informatics technology. So you will see that clinical systems companies, the hospitals, health system and practices, healthcare and industries, and academic medical centers, all these are in the health informatics technology. Whereas in more on research and development, all those are under biomedical research community and also biomedical informatics. So now look at slides 21. Some of the time it is not only one way that the biomedical informatics feed to the health informatics technology, but the data, the analysis captured from the health informatics technology, it also synergize and feedback to the BMI, so the biomedical informatics, in order to improve or to do some adjustment for a certain parameters or a certain particular algorithm. So now, sometimes you will see that people introduce health informatics as in medical informatics. So now this medical informatics or health informatics is the intersection of information science, computer science, and healthcare. So you look at one big component here will be healthcare. So healthcare here is always associated with public health. Okay, public health or the public informations. So all those are the area that associated with health informatics. So now slides 23, you will see that there is a lot of integration between clinical and basic biomedical sciences, cognitive science, decision science, public health science, organizational science, computer and information science. So it is not just one discipline by its own. So health informatics is actually integration of all these components to make it a particular platform. So let's move on to medical informatics in 24, slides 24. So medical informatics has been defined as the art and science of organizing knowledge of human health and disease and making it accessible and useful for problem solving. So according to the Bulletin Medical Library Association, near 1996. It defined that the medical informatics is the important aspects, especially the internet is truly the defining information structure of the global village. Okay, so these particular terms capture from the Bulletin Medical Library Association. Okay, so these are the link, slide number 25. The link for WHO, US Healthy People, CDC, and all this information that related with health informatics. So if you look at those particular link, slide 26, you'll see there are tremendous information there. It's not just a bulletin, but it also actually link or integrate with certain theoretical aspects and also statistical information and also certain related topics, health topics, publication, and also some depository. So these are the platform that has been generated in order to support the public health domain. So let's move on to public health, slide 27. So public health is defined as a health promotion and disease prevention is an aspect of public health practice that can be dramatically transformed by informatics. So now, all of you understand that public health is one of the subsections or subspecialty in the medical field. So now the public health component looking at the health promotion and also disease prevention. So what are the career opportunities? Innovative collaboration, consumer health, application development, networking opportunity with national and global organization. So these are the area where associated with public health. It is not just a particular public health medicine alone. So it's about integrations, information and knowledge. Slide 28. Public health is concerned with improving. Wait, I want to see whether the thing is still not able to share. Sorry, don't know what's happening. Um, slides 28. Public health is concerned with improving the health of entire population. That's why it's called public. It's not health alone. So other than that, it's informing, educating, and empowering people about health issues. So apart from that, public health informatics allows researchers to look at new insights and innovative solutions to health problems. So the other component relate to diagnostic and also investigating health problems and also hazards in the communities. So these are all related with public health informatics. Somehow is also associated with health informatics. So now very often you will also heard about medical informatics and health science librarianship. Slide 29. So this particular component delivery of relevant information to clients in the clinics, laboratory, and other health-related works environment. So this particular area create knowledge-based products and resources. So from the term librarianships. So why they use this particular term is a collections of a certain information in the house of like the database that people can be retrieved and used wisely. So addition on those particular information that informaticians and librarians are both analyzing how to best integrate filter knowledge into decision support system for clinicians and researchers. So these are the role of informaticians and librarians. So you will see that as a technologist, sometimes you will see that some other clinicians or some other informaticians and librarians play a major role in terms of supporting or feeding a certain information to the clinician and also researchers. Slide 31. So what are the new definition of health science informatics? So now there's a advancement in terms of terminologies from health informatics. Sometimes they call it health science informatics. So health science HSI, health science informatics addresses how health-related information is structured, acquired, and utilized. So more or less the same. There's a lot of these particular changes of certain terms due to the advancement of a certain technology and approaches. Slide 32. What are the new challenges that most of these, particularly health science, health informatics, all these spaces? There's a changes in healthcare delivery and information technology. When you're talking about like mobile health, so now with all these advancement of mobile apps, I think every individual can access almost everything from their handphone or through the particular mobile apps. So there's a huge development in this particular area. So biomedical informatics applications have potential to bridge the gaps between the pool of scientific knowledge and individual healthcare related information needs. So of course, when you look at health informatics, most of the times that this health informatics not only feeding to the public or the end user or to the particular patients, but health informatics most of the times that integrate the hospital management entire systems into related with information of the clinical decision and also a certain requests from the patients, etc. So moving forward, all these other challenges, there are libraries, slides 33, libraries are uniquely understand and provide information resources and those who existence and librarianships. So librarianships most of the times that from the word itself is a store and gather and also retrieval. But informatics most of the times you will also associate analysis, filtering, analysis, displaying, and etc. Okay. So again, what are the other challenges? Is the goal is to engage students and practitioners in the process of becoming self-directed learners, like in the new era, new norms. So that like I think most of the encounters, lectures encounters is online. Similar as in the future, maybe through all this consultation, okay, clinicians, patient consultation can be done through the particular online or electronic infrastructures. It is no longer like applicable face to face. However, I would say that most of the things is limitation. Okay, so there are certain means that you cannot access through online. For example, a certain structures, for example, certain morphology or certain responses of these particular patients, all this information can only be accessed through face-to-face or physical kind of contact. So slide 35. So moving forward again, there is a delivering, what are the other challenges? What are the preparation that requires for the new challenges is delivering healthcare globally, how to deliver a certain information or a certain context from this particular end to the another particular efficiently, addressing societal problems. So not only that just connecting, just like all these the electronic lectures or online lectures, not only just delivering. So how do we address problems, students' problems? How do we solve students' problems? These are all analogy, something similar. Same goes to health informatics. So there is a lot of societal problems. How do we resolve? It's not just a connecting all together, but there is also a certain platform enable the problems to be resolved. So of course, the health literacy and also digital divide. So there are also some population might not be able to access certain digital kind of technologies. So not everyone is affordable in a way. Slide 36. So what are the opportunities? So you see that the opportunity includes the point of care, ethically relevant resources. So now you can see all those clinical trials, all those research effectively. You can also look at the health information programs available easily, and some other information related information, and also education materials. There's a lot of self-learned kind of information, and also web technologies, etc. So other than that, you also have a patient care system, telemedicine. As I mentioned, keep mentioning telemedicine. These are the new area, not to say very new, that people are still advancing and developing area, telemedicine, image management system, computer-aided surgeries, and etc. If you go to when you when you perform a particular X-rays or MRIs. So previously, you need to actually develop that X-ray film, and then you need to take that physical film to actually then see the consultants or the what we call that the specialists. So nowadays, you do not need to, because all this imaging, all this image captures, what we call that the clinical image captured, can be viewed by the clinician directly. So it's no longer like waiting a long waiting period to develop, and then there is a cost also incurs. So with all this health informatics in place, so I believe that one, it will shorten the period of assessment, the clinical assessment. Second, it will actually also reduce the cost of intervention, and it can also make things more effectively in terms of medical assessment. Okay. So now, slides 38. Who does health informatics? Okay. So now we will look at that. Everyone in the everyone out there and everyone inside the medical system. So ranging from the patient, medical profession, government bodies, primary care, the general practitioners, national agency, the finance, the admin management of the hospital. So sometimes need to submit their claims, okay, general population, to assess all this information related to certain diseases. The public need to know about the notice, the awareness, and then the policymaker understand the risks and etc. And regional managers and tactical management to understand what are the disease control, for example, the facility management, operational management, for example, to book a particular operation theater from remote area, from one particular hospital to another, healthcare providers, so healthcare researchers, healthcare educators, and their students. So they are trying to actually integrate all this so that everyone can have their particular access to a certain extent. So, however, when all these are possible, there are certain ethics comes in place. So because it is involved, all these patient histories, individual informations. So that's why there is ethics. And I believe that you have gone through lectures on bioethics. So that is one of the lectures. That's why in health informatics, it is very important to understand ethics. All these informations are available, but there are also some ethical components that lie behind all these particular applications. So move on, slides 39. So what are the application of the health informatics? There are tremendous application, since that this particular area is wide and huge coverage. So for record accurate of data, to have a data available in a timely manner, that means everyone can access. As I said just now, I give you examples. The X-ray can be accessed by clinician just by a few seconds or by a few minutes after the exposure. So, and to support and inform managers to make a certain decision faster, so that the managers can actually look at what is happening, and from the analysis and also all this data, they can actually support this particular person to make a decision better. So besides that, it also resource allocation from planning and a certain therapy, and also risk management, training, support for shared care, patient assessment, evaluation of patient care, monitoring of patient, staff coordination, tracking patient in the hospital, stock management, tracking sterile supplies, integration engines, mobile computing. So all these are some of these particular application, and the list goes on. Okay, so now you look at all these are possible not just because just the software or just the platform. Mentioned earlier, the communication part is very important. So the electronic communication is very important. Either it is telecommunication, intranet, or internet. Okay, so those are the area that are very important. So as I said, the list goes on. Go to the drug control, medication, dispensing, ordering, purchasing equipment, payroll, the salary, etc., honorariums, etc. So clinical pathway, labor management, patient scheduling, budget analysis, research, work processing, national database, quality assurance, donor database, devices, monitors, analyzes. There are so many, okay, applications in terms of health informatics. So that's why it is important to understand the area of health informatics. So you realize that under this allied health profession act, there's also one of this profession called health promotion. So that's very associated with health informatics. So even though it is a profession, and very soon you will see that this area is coming up because of all these integration of electronic infrastructures. Slides 41, we move on to one particular specific area, what we call it telehealth. I keep on mentioning telemedicine, telehealth, okay? So telehealth is the delivery of health-related services and information via telecommunication technologies. So sometimes a lot of people may misuse the telehealth and e-health. Electronic health is just electronic infrastructure, okay? So on the health system, but telehealth is always associated with telecommunication. That means there is a connection between like your handphone, like mHealth, okay? So telehealth delivery could be as simple as two health professionals discussing a case over telephone, or as sophisticated as using video conferencing to between providers at facilities in two countries, or even complex as robotic technologies. So sometimes you will see that surgeons now do not maybe required to go to the operation theater, but they can operate remotely from their office, okay, by using all this telehealth. Because nowadays, all this high-end technology can be automated, created, designed in a way that the human can operate or remote control that particular equipment to a particular distance area. Slides 42. So telehealth is an expansion of telemedicine, and unlike telemedicine, which more narrowly focus on the curative aspect, so this particular telehealth is encompasses of preventive, promotive, and curative aspects. So telemedicine most of the time is only focused on the curative aspect. So originally used, this particular telehealth originally used to describe administrative or educational function related to telemedicine, but today's telehealth stresses on myriad of technology solutions. For example, physicians use email to communicate with patients, order drug prescription, and provide other health services. So again, as I said, this is talking about emails. Okay, maybe perhaps nowadays you have a lot more social medias. You have more like mobile apps that allows the clinicians, the physicians, to communicate with the patients more effectively, and to allow also these people to order their prescription better. Okay, slides 43. So what are the clinical uses of telehealth technologies? So first, you have this transmission of medical images for diagnosis. As I mentioned earlier, So transfer from X-ray from one particular setting to the clinics, okay, often referred to as store and forward telehealth. Groups of individuals exchanging health services or education live via video conferencing. So what we call real-time telehealth. That means you can consult a particular groups of patients or individuals via video conferencing, and of course transmission of medical data for diagnosis or disease management, sometimes referred to as remote monitoring. Okay, that means you can assess that particular patient's disease condition after a certain period of time, where the patient enjoy the benefit not to come to a particular setting or clinics just to get access. And of course, advice on prevention of diseases and promotion of good health by patient monitoring and follow-ups. So I would say that this telehealth enhance the particular patient monitoring, and also it speeds up the problems arises during the medication. So now slides 44. What are the non-clinical use of telehealth and telehealth technologies? So other than non-clinical use will be always education. So including continuing CME, continuing medical education. I think now is so used, everyone's so used to all this Zoom, so used to all these online lectures, webinars, everything. So goes, it always, it's all expanded to the professionals um, area where there is CMEs, grand rounds, and patient educations, all through this particular distance learning. So apart from that, administrative uses, including meetings among telehealth workers, supervision, and presentation. Imagine these particular slides all created maybe 5-6 years ago, but now you see the reality now, due to pandemic, all these things all become so useful. So apart from that, the non-clinical use will be research. Although research is not that expanding in terms of telehealth, but I think the year this particular area will be expanding soon. Then it will be, because to have a telehealth in research, it is not easy first, and secondly, it is not cheap. Okay, to control all this high-end equipment in research, and also sometimes you really need a physical contact to that particular research component. So other than that, there's online information and health data management, and also healthcare system integration. So now, so you have also telehealth modes in telenursing. So you will say that some of the time that telehealth very associated with telenursing or nursing area. So telenursing refers to the use of telecommunication and information technology for providing nursing services in healthcare whenever a large physical distance exists between patient and nurse, or between any number of nurses. So you see that when this particular area is actually applicable, it is in the pandemic era. For example, now the COVID seasons and all these things. So we have lack of supporting staff, lack of nurses. So I believe that by using these telehealth approaches, so many of these shortage of nurses services can be resolved in a way, but not totally. But apart from that, as a field in this telenursing, it is part of telehealth, and as has many point of contact with other medical and non-medical applications such as telediagnosis, teleconsultation, telemonitoring. So this all area is so much application and so related, especially in the area like, for example, now in the MCO and all these things. So now moving on, recap a bit on the e-health, electronic health. We go into a bit detail. So this particular e-health is a relatively recent term in the way, okay, in the healthcare practice, which is supported by electronic infrastructures, as I said, and also communication. So sometimes people interchangeably use healthcare informatics in e-health, okay, and it's also said that this healthcare informatics is a subset of health informatics. So while other uses it interchangeably, And most of the time that, as I keep on mentioning, is about communications. So with the communication, the platform and the apps, the software, okay. So it's and internet connections, what we call it telecommunication. And the term here, e-health encompasses a range of services that are at the edge of medicine, healthcare, and also information technologies. Slides 48, sorry, slide 47. So electronic medical records. So all these particular terms that I share with you is all associated with health informatics. So very often you will see that there's electronic medical records. It enables easy communication of patient data between different healthcare professional, GP, specialists, healthcare team, pharmacy. So now come back, the telemedicine includes all types of physical and physiological, not physiological, psychological measurements to that do not require a patient to travel to a specialist area or centers. When this service works, patient need to travel less to the specialist, or conversely, the specialist has a large catchment of area. That means at one point of time, the specialist can attend many patients rather than they need to schedule and need to see that patients physically. So evidence-based medicine, so those who are in the area of public health, in the area of medicine, they always heard about this EBM. So evidence-based medicine, it entails a system that provides information on appropriate treatment under certain patient's condition. So a healthcare professionals can look up whether his or her diagnosis is in line with scientific research. So the advantage is that the data can be kept up to date. So this particular area is very important and is very useful in both ends, to the clinicians and also to the patients. Slide 48. The term consumer health informatics, okay, CHI, or sometimes we call it citizen-oriented information provision. So it's both healthy individuals and patients want to be informed on medical topics. So these are the areas that I mentioned. So it also being classified as one of the professional nowadays that has a health promotion. So these are all areas that covered by the health promotion professions. So apart from that, you will also have health knowledge management, or I call that a specialist-oriented information provision. For example, in an overview of latest medical journals, best practices, best guidelines, or epidemiological tracking, and also a certain virtual healthcare teams, okay, consists of healthcare professionals who collaborate and share information on patient through digital equipment. So all these are a very important area. As I keep on mentioning, health promotions officers are now already in place. It is not something that created just for the sake of fashion, or for the sake of just to enrich a certain area, but it's become a professionals. So maybe in the private settings we don't see it, but in the government hospitals we will see there is a particular, what we call that, jawatan, a post called health promotion officers. Okay, so slides 49. Health informatics supports for the translational medicine. So in the translation medicine, there are three basic areas. There is basic research, uh, transfer to clinical research, and also health services. Let's look at these three components one by one. In basic research, it involves bioinformatics and image management. It involves also knowledge resources such as literature, gene, and images. It also involves intelligent access to distributed resources, and also certain researchers' workstations and network. So when we move on to clinical research, we all deal with the common terms and data models, the participants recruitment or the patient recruitment, and also research registry and data repository, and also certain VR, the virtual reality environments. So these are the areas that covers in the research. Let's look at health services. So the health services in slide 51, so it covers the organized, accessible clinical data. It also covers the common terms and standard definition, intervention infrastructures, and also guidelines delivered to the point of care. Okay, slides 52. So these are the other technical challenges that associated with the interventions of the information technology. Informatics, health informatics. Sorry. So in the complex nature of medical data, so alphanumeric kind of context in the lab result, because why this time become a challenge is because when you do a programming, sometimes it become become more complex when you mix alphabet and a numerical kind of platform. So, and also in the text of discharge summary, signals which is monitors. So different machine give you different signals, and different signals use different languages, programming languages. This is very important and very different languages. For example, image, X-rays, the definition, so the resolution, the definition of the pictures or the pixels of this particular diagrams, photos, and images actually also become video or sometimes be clear, all the resolutions captures all the size of the very difficult transfer from one platform via connection telecommunication. So other than that, user interface, which is the data, can be a very challenging. So apart from that is highly reliable, efficient, and secure information management. These are the area that I think I highlighted just now, the ethical component. So how ethical that all this information are available to be accessed by certain individuals. So apart from that, integration of IT into routine clinical practice, what we call it paperless hospital. In Malaysia, there is one hospital that claimed to be paperless hospital. But until now, I think, I don't want to name what and which hospital. You can survey from the web and have a look. And they are ambitious to claim it's paperless, but if you go to that hospital, you will see paper still used as part of the routine. Okay, so apart from that, cooperative hospital computing, people are trying to see how you fully utilize computing to operate the whole hospitals, and it's not possible in a way. Sometimes because computing and all this rely on electronic rely on electrical or power supply. So what happens if there is a power shortage? So the whole hospital can be affected. So apart from that, there's a multi-vendor component where people are trying to see whether purchasing, whether all this asset monitoring, all this can be done through all these health informatics, which is one part of the challenges. So what are the organizational challenges? Slide 53. So the organization challenges, that means the management component, which are the integrating IT into the business processes. So how can that be possible? It sounds easy, but it's not that easy as when you want to implement, because every single department, or what we call that department or segment, can be very challenging in terms of certain data can be collected and integrated. And also understanding the domain to which the applications is being applied, and training staff on the new system is not easy, especially those people who are so used to certain approaches. So I mean traditional, or what we call that manual approaches. So apart from that, introducing the new system to patient is not also easy, because not all the patient is IT literate, and also not everyone actually afford, as I said, to have this system in place with them. So apart from that, maintenance of the system is not cheap. Okay. certain upgrades and certain maintenance required per year is very expensive, especially when it comes to all these electronic infrastructures. And of course, the resources, location, staff, and money. So you look at all these when you want to establish all this health informatics and also all this integration system, one of the main issue is the storage. So like it or not, it's not just like buying a cabinet and do the filing and put all the file inside. That is the storage. So in the electronic infrastructures, one of the main issue storage comes with the servers. So servers requires a very, very, very high-end kind of control rooms. So it required 24 hours of temperature control, humidity control, dustless area, and etc. So these are not something easy, but in long run, I believe that with these particular integrated systems, this actually help overall the whole entire medical infrastructures. So I think that's an overview of all these technologies and also area that involve. I wouldn't be going into deep one by one, saying that be able to go into a single software and look into it, because it makes no sense that I'm actually sharing all this software and all this platform, and then suddenly when you go out to work, you face another different kind of software and platform. So, but all you need to know is there is a lot of development behind all this, what we call that health informatics. So all this area, or if you realize that this particular course is new, and it is something that area that you need to expand, okay, and it gives you a lot of particular opportunity. I can tell you and assure you that this particular area is where all these people or all the graduates should look into, and unlike like the conventional approaches where every graduates are looking into the labs based kind of approaches, or a particular physical kind of work. Okay, so these are the area that you can work from home, work from certain area, work from a distance, remote controls and all things. It's not just you can do it, but how to do it and when to do it. So those are the things that you need to actually resource it by yourself. Okay, so with that, I think I end my topics today. So now, as I said, this is a very broad area. So, and I won't be going into deep, because if I go into deep, it becomes like a programming. It's like become even more IT related kind of area, which I don't think all of you benefit, because those are the area is very technical know-how. Okay, so now to make sure that all of you understand and appreciate the topic, so I have uploaded some assignment for all of you, and it will be graded, the assignment. So now I just wish to understand that, or hopefully all of you hearing now. So just to get your response, all of you hear what I'm talking?
Yes, Prof.
Huh?
Yes.
Listen
Yes.
carefully.
Yes.
All of you can access the Putra Blast. I have about 12, I think, 12 topic there. Okay, who is the class rep? Who is the class rep? Anina,
Yes,
is it?
yes, it's me. Yeah.
Hi, Anina, are you talking?
Yes,
Anina,
yes,
are you talking?
yes,
Okay,
I'm
listen
talking.
carefully. Okay, good. So, are the class rep. Listen carefully. These are some of your tasks. So, there are topics. Okay, divide 110 into groups. Okay, so I believe that there are about, some of them will have 9, or some of them will have 10, right? Members in group, correct? So there are
Yes,
many people in a group. So I believe that the task can be easily achieved just few days. So look at the instructions in assignment given. So you need to do a particular assignment, written assignment on that particular topics. Most of it will be application. Okay. So how to do it? You either find information from the website, or you can see all these particular apps in your phone. Okay. So those are the area that you can resource to. You need to do two. One is written assignment, one is a video. So the video is up to you. You want to make it like a PowerPoint translated into a slideshows in a video. And then what I need in the video is an audio. That means there's someone talking. I don't want a video which is only slideshows. Okay, so that is too easy for. So let's say in a group 10, divide 5 person doing the assignment, written assignment, 5 doing the video. So I believe 1 hour, 2 hours you can complete already. Okay, so there's no limit of time for the video, but of course don't do it 1 hour. Okay, so you need to upload that video in a channel. So all the 12 video need to be uploaded in a channel. Then send me the link. Provide the link in your written assignment as well. So each video upload, there's a link, right? Provide in the assignment, in the written assignment. Submit your written assignment into the Turnitin. Okay, so I will provide the Turnitin later. So now each particular group need to assign a group leader. So now later, Anina, you need to collect all the group leaders' email to me, because I need to upload their emails in the Turnitin. So group leaders, your duty is to upload your assignment, only, your assignment, written assignment only in the Turnitin. Check the plagiarism. If let's say it turns out 40, then you can see where is the area that you plagiarize similar. Change it, restructure the sentence, etc. Then upload again in the Turnitin, because you can upload as many as possible. Turnitin. Upload until you certify. That means below 20, below 30. I put it below 30. So it's very, very linear to you, because usually it's below 20. So I give you below 30. Once it's below 30, download the particular Turnitin reports together with your written assignment, the revised written assignment, submit it to my Gmail, not my medic mail, not my formal mail, my Gmail. I written in the Ultra Plus. Whoever which group send me to the formal mail, marks will be deducted for all the 10 members. Very clearly in the instructions, send to my Gmail, because my main mail, formal mail, already full. So do not send it there. You will jam it. Okay. So send it to my Gmail. I repeat, send it to my Gmail, not UPM mail. Okay. So that's it. So you have only 1 week. So the deadline is 8th of February. Okay. So bear in mind that you need to submit all the members of the group in the written page, the name and the matrix number. So all of you need to submit the group member's name to Anina. So Anina, you need to prepare an Excel sheet stating all the group members and their names. You know what I'm trying to say? So that I can key in your marks later. That means if it's group 1, members, you slot in all their marks there and supply it to the coordinators. Because I give it to all of you to find your own members. But just make sure that all members only appear once in your group. You cannot be a member in group 1 and then a member in. So after all the members or the listen carefully, only the group leaders, upload the information. Only group leaders submit written assignment and also video to my Gmail. Not all the members. There's no limit on the page. It's up to you. But please do not just provide one page, of course. There are 10, okay? So if half, if what you give a page. So use the logical sense. Don't give me just 2 pages. Means one of you just provide 2 sentences. Cannot be what, right? So there's so many information available, and make sure 2 things. Make sure that your video there's an audio, and make sure that your written assignment is below 30% of the plagiarism check. Okay? Can Anina?
Yes, Prof.
Yes, sir.
Yes.
Okay. Sure. Okay. Yeah. So any questions so far? If you're unable to speak, you can chat. Any questions so far? I believe it's a very open topic. It's not a very high.
Sorry, Prof.
Yes.
Sorry, Prof. One question.
Who is
Is it
speaking?
about the channel?
Who is speaking?
Sorry, is it about the
No, can you introduce yourself first before you speak? Because there's so many of you, I don't know who is talking.
Mutadi.
Okay, yes, Butadi.
Okay, about the channel to upload the about the channel to upload the video, is it
Yes.
just is it we need to submit we need to upload the video for only one channel that represent for 10 groups or just individual channels?
Up to you. Up to the course rep, up to Anina to arrange. If you want, some of you want to upload in YouTube, some of you want to upload in I don't know what platform, but then I suggest everyone upload into one channel in YouTube. It's easy for everyone to see. So you see, these particular assignments is not do it for myself, you see. So it is for both way, the problem-based learning, student-centered learning, SCL, PBL, and all these things are incorporated. So the information that you get, the group that you get, all this information, I would say that is partially valid because you go through all this assessment from the website, because it's not hardcore technical, you see. So it's about all this application, etc. So the rest of the group can benefit by watching the other group's outcome. Make sure that you put it open to at least the group members. That means to at least this particular course. If you don't want to put it open to public, put it open to the whole course. So Anina can generate a channel for this, and then upload all the 12 videos there. So now, as I said, the videos can be, you can be appeared in the video, or sometimes you can use a Powtoon or whatever doodles, whatever things that you find it convenient to you, or you can draw, it's up to you, or you want to add inside, it's up to you. But creativity is actually contribute to the marks. Of course, the accuracy of the text that you're given also contribute to the marks. So for my part, I do not have finals. I do not have a part in my finals. So these components serve as part of your finals marks, you see. Part of your assignment, part of your final marks. That's why I need you to provide two. One, the assignment written, and also the one with the video. So there are 10 of you. If the video and the written assignments not good, 10 or 9 of you sharing those marks. So there's no complaint because there are 10 or 9 of you. So you should have a very fantastic video or a fantastic write-up. Don't give me all this write-up with different font size. One paragraph with font 12 and then another paragraph in font 11, like copy and paste, and then you submit. So these are half-heartedly done work, half-cooked work. So half cooked or half done, so your marks also half lah. Okay. Okay. So I suggest there's some chat there. I suggest Anina to compile the video into one playlist on YouTube. It's up to you, okay? Plus, up to you how you arrange with Anina. Anina, you can host a meeting with all of them or with all the group leaders, and then you can arrange with them lah. So this is your leadership skills. Okay. Can?
Okay, Prof.
So make sure,
Yes.
please make sure by tomorrow or the day after tomorrow, give me all the names, metric number, and also email of the group leader, the 12 group leaders, because I need to submit it to the Turnitin so that you can submit your assignment. Okay?
Okay, Prof.
Okay, yeah?
Yes.
So if there's no questions, I think that's all for today. So all the best to all of you. Good luck for your final exam. Stay safe, take care, and I will see you in next semester. Okay?
Thank
That's
you,
all.
Thank you,
Professor.
Prof.
Bye. See you.
Thank you,
Thank you.
Prof.